David Cameron has apologised to the thousands of people infected with hepatitis C and HIV through tainted NHS blood supplies in the 1970s and 80s. He says an extra £25 million will be made available to help them. A report into the affair in Scotland has described the saga as the stuff of nightmares, but concluded few things could have been done differently. Some relatives of those who died have denounced the findings as a whitewash. Time is 23 minutes to 5. You're listening to Good Evening Wales. Now, it's been described as the worst treatment disaster in the NHS history and the stuff of nightmares. Thousands of people were infected with hepatitis C and HIV through NHS blood products in the 70s and 80s. Hundreds of those affected were in Scotland, which was the only part of the UK to hold an inquiry headed by Lord Penrose. But the inquiry has made only one recommendation, that anyone who had a blood transfusion before 1991 should be tested for hepatitis C. Well, we're joined now by Lynne Kelly, Chair of Haemophilia Wales, who is in Scotland. Good evening to you.
Good evening.
Also with us is David Thomas from Penarth, who has haemophilia and was given blood infected with hepatitis C in the 1980s. Good evening to you, David.
Good evening.
David, can I ask you first of all then, as somebody who is one of the victims in this, how do you react to the inquiry's findings?
Today has been probably the biggest letdown that the haemophilia community has suffered, I would think. We've been waiting 30 years for something, and today we thought we were going to get something, and it's just been a monumental washout, really. What
were you hoping for? Were you hoping that some blame would be apportioned somewhere? Because that's the one thing Lord Penrose hasn't done.
Yeah, we were hoping that there would be some culpability identified as being with perhaps the Department of Health or the government of the day, but nothing has come out of that nature, really.
Can you tell us what it's been like for you? I mean, you have haemophilia. You were given these infected blood products, as you say, 30 years ago in the 80s. How's it changed your life?
Yeah, it's transformed my life since I found out when I was about 24 years of age. And you know, it's been a permanent worry that I have to bear kind of every day. I have two young children.
For people who don't understand what hepatitis C is, how serious is it?
It's life-threatening. It's my liver is on the verge of cirrhosis. I was identified as having stage 4 of 6 fibrosis, which is the stage that precedes cirrhosis. 5 years ago, there's a little bit of uncertainty as to where my health is at the moment, but I've had one cousin die from this condition. I have another one awaiting a liver transplant. And
were they given infected blood?
Yeah, yeah, they were infected at around about the same time as I was.
As I said, Lynne Kelly is with us also, Chair of Haemophilia Wales. Lynne, David's example, and he's talking about his family there, is that fairly typical of how a lot of the victims feel?
Yes, obviously we've come up today. We were hoping to get some sort of closure for victims. As David said, they've waited so long. You know, in Wales, 226 haemophiliacs were infected with hepatitis C and HIV in the 70s and 80s. You know, 70 have died, and those families deserve some answers as to why you know, their loved ones have died, and the survivors are unfortunately still having to suffer the effects of the disease, both hepatitis C and HIV.
What do you make of Lord Penrose and the inquiry's finding that, as they put it, or as he put it, few aspects in which matters could or should have been handled differently, that not much could have been done differently? Do you agree with that?
No, we would strongly disagree with that, and we would look to Lord Archer's inquiry and the recommendations that he made.
What recommendations did he make for our audience who doesn't know?
Right, well, his recommendations were that, you know, things could have been done differently and warnings weren't taken, and the whole disaster could have been avoided if the Department of Health had acted and, you know, demands for self-sufficiency were met. But unfortunately, due to a cost-cutting exercise, that didn't happen, and patients continued to be treated with concentrates were actually known to be contaminated at the time. So, you know, we feel deeply disappointed for all those families who have lost loved ones, and for those who are currently fighting the disease and losing the fight for their disease.
David Cameron, the Prime Minister, has apologised on behalf of the British government. He said the government is going to provide up to 25 million this year and next year to support victims. Is that enough, or will you be campaigning for something else?
We will be definitely campaigning. It is nowhere near what is needed to, to compensate people for what has been lost. 25 million is nothing for what these people have lost, and for the last 20 years, you know, people have had to live on the poverty line. They've had to continually apply to the various trusts that have been set up, which are again controlled by the Department of Health, and they're not there to support beneficiaries. They are there to prevent beneficiaries from receiving payment.
Can I just ask, David, how do you feel about what the Prime Minister has said?
I'm a little bit perplexed on a day where the Penrose inquiry reported that there wasn't really any culpability, that David Cameron decides to announce that the government, after 30 years of asking, is now sorry for what's happened, and that things could have been done differently at the time. So it's a little bit contradictory to what the Penrose report states. But I'm a little bit perplexed. But it falls far short of any meaningful resolution to this. It's a pittance amongst a community of thousands of people, with no recognition of the people we've sadly lost along the way, the 2,000 or so that have left families without money, without sources of income, living on the poverty line. It's grossly insulting.
Okay. Thank you very much for talking to us today, David. That's David Thomas from Penarth. We also heard from Lynne Kelly, Chair of Haemophilia Wales.